Good afternoon, everybody. We're welcome to the Georgia Hispanic Chamber of Commerce webinar for today. We're going to wait a few minutes to get people to sign in. Just a few minutes while people, I'm looking at the count, people are just signing in, so we're going to wait a few minutes to get this going. So we'll start in a few minutes, okay? Thank you very much. Okay, well, thank you very much, everybody, for tuning in today. My name is Gabriel Vaca, and I am the Executive Vice President of the Georgia Hispanic Chamber of Commerce. We are a business chamber, one of the 10th largest in the country. There's about 300 Hispanic chambers in the country. We're considered a large chamber with 1,300 members. We've been doing the chamber business and helping Hispanic businesses grow, small Hispanic businesses, larger Hispanic businesses for 36 years. So we have institutionalized everything that we do. We have strong partnerships, and we partner with many organizations to help Hispanic businesses grow in terms of financial education, financial literacy, events that we do, as well as we have partnered with many other chambers of commerce, which we call them the mainstream. We are called a diverse chamber, like the Fulton County Chamber of Commerce, the Gwinnett Chamber, Cobb, Gwinnett, Henry, Douglas Chamber. And we are associated with the Georgia Chamber of Commerce, which is an award-winning chamber that has been doing the chamber business as the #1 chamber in the country for 3 years. So Georgia is a place to do business. Georgia is the place because of all the environment in terms of business. And the city of Atlanta, as well as the state, is a welcoming state for business. So as a Chamber of Commerce, when this COVID-19 hit, we did disaster relief, and that's what was one of our items to do, because our Hispanic businesses wanted to know information, especially about health and wellness. And once we did that, we did like a 1 webinar a day. I know that there's a lot of webinars and Facebook Lives that you see, but then from that, we have converted our chamber now into resilience and recovery. And resilience and recovery is very important because obviously, as health and wellness and awareness of COVID-19 still exists today, we want to open businesses, and we want with the primary purpose of making sure that our people are safe, the employees are safe, the business owners are safe, because a lot of these businesses, they closed, and maybe a lot of them will not open again. And our job is to make sure that some of these businesses, they can open, they'll open. So with that, I think that health and wellness is a priority now for all of us, and we have partnered with Northside Hospital today. I think health and wellness is the most important item that we have today. That was a lot in the back burner, as we see from a business terms, but it's not. It's the #1 item today, along with recovering businesses and helping businesses. So that's why we are partnering with Northside Hospital. And I want to thank everybody here today. I also want to thank Valeria Pacheco, who's a member of our chamber, as well as Northside Hospital as a sponsor, because this is very important topic. And we're going to do a series of these of health and wellness and everything they have to do. With this, we have a great lineup today. In the Q&A chat, I know our moderator will talk about that for Q&A, but we do want to introduce Mariela Romero. She's an anchor in Univision, a very well-known advocate for Hispanic business, Hispanic community, and she does a lot of work from a community fairs, not only in Georgia, but in other states, and she could talk a little bit about that. So I'm going to leave here because I want to make sure that you guys are welcome with these experts and Mariela Romero. So take it from there, Mariela, and thank you very much for your participation today. Gracias.
Thank you. Gracias, Gabriel, for that introduction. Good afternoon, everybody. My name, like Gabriel said, is Mariela Romero. I am the Regional Community Empowerment Director for Univision Communications, and it is my honor to welcome you to this GHCC webinar in partnership with Northside Hospital. You know, the information we're going to be sharing today is going to focus around the topic of how physical rehabilitation and nutrition plays a key role in those suffering and recovering from COVID-19. Rehabilitation and nutrition experts from Northside Hospital are going to be talking to you about the clinical explanations behind the contraction, manifestation, and aftermath of this disease, as well as a very important topic to me as a journalist. They're going to be talking about their own experiences in the field. Not only will they provide insight on how to keep you and your family safe, but also information about what recovery is like for the thousands and thousands of Americans that already are infected or are recovering from this disease. You know, being informed is our greatest defense against COVID-19. Don't you agree? So if you agree with me, we have a great panel of experts discussing this with you, and I'm going to introduce them. Varsha Kanvide is physical therapist. We also have Melora Rennie, who is occupational therapist. Susanna Zoll, who is a speech language pathologist. They are all with Northside Rehabilitation Services. And also we have Elise Clots, who is a clinical dietitian nutritionist with outpatient nutrition services at Northside Hospital. And I want to start the conversation with Varsha and Elise, because when we discuss COVID-19 in the media, we focus on the patients who are in the ICUs and ventilators and all that. But we don't talk about what happens after you recover, especially if you are recovering because you were hospitalized in the ICU. I want to share something that many people do not know. I used to be an interpreter for a period of my life, and I used to be an interpreter at Northside Hospital in Children's Healthcare of Atlanta. So I know what rehab looks like in terms of occupational therapy and physical therapy, how important it is, and speech therapy. It is extremely incredible. But when we are discussing COVID-19, we are not thinking of rehab. And I just want you to explain to us what does it look like, and how many patients who recover from COVID-19 need that interdisciplinary approach to their recovery. So Elise or Varsha, can you expand on that?
So I can get started. So I'm just going to present an overview of what happens when somebody contracts a COVID-19 infection. How does it affect the person's function, their ability to move, their ability to go work, and so on. So as you all know, we are all here today because we've realized that the Hispanic population has taken a hard hit because of the COVID-19 infection in all the minority populations. And there are CDC statistics that were released this month that stated that even though Hispanics made about 18% of the total population in the US, they have made up about 33% of the total cases with COVID-19 diagnosis. In states like California, where there is a heavy density of Hispanic population, 43% of the population is made up by the Latinos. But the Latinos, unfortunately, have contributed to 70% of COVID-related deaths in that state. And in New York City, Hispanics are dying at a rate of 50% more as compared to Caucasians. So I want to just review what makes it so difficult for this population to combat this disease. So because we're here for the Hispanic Chamber of Commerce, so we all know that their employment is primarily in the service industry. And because of their economic circumstances, they need to continue to work. They cannot be out of work because they have to put food on the table. They have to take care of their families. So they need to continue to work. They are not able to shelter at home and self-isolate or quarantine during these public health crises. There are also social issues. Their housing is often unstable. They are staying in close quarters or close proximity with multiple other family members or friends. And so that also then makes self-isolation or quarantine even more difficult for them. A lot of these people, as we know, to be honest, are also undocumented. So as well as others who are working may not have health insurance. So they're not able to access healthcare, proper healthcare. They're not able to access medical care, even when they are sick because of the financial implications. So if they take a sick leave, they may not have sick leave. If they stay sick at home, obviously they're not going to earn money to put food on the table. And then lastly, there is a lack of health literacy. That means they may not realize when is the right time to get medical help. And they wait and wait and wait until it's a life-threatening emergency to get to medical help. So just a few things. How does COVID-19 affect a person in general? What does this virus do to us, do to you? So this is an infection that affects the lungs and breathing, and it often presents with flu-like symptoms or presents like pneumonia. But this virus is much more severe and its effects are much more widespread as compared to the seasonal flu or pneumonia. So it seriously affects our lungs' ability to provide oxygen to our body to such an extent that they have to be admitted to the ICU and they have to be connected to machines like ventilators. We've heard of ventilators, ventilator crisis, and so on. So they are hooked up to these ventilators in order to help them breathe and survive. And so what happens during this time where we are making efforts to help them survive this illness, these patients are kept on bed rest for a long time. They are sedated and kept unconscious by using strong medications for a long period of time so that their body can rest and heal. And they are also given those powerful medications to fight the virus itself. So during this long period of immobility, where they just can't move, our body is literally breaking down the proteins in our muscles as an effort to survive. So that's what's going on. And all this, when you put this together, has a very severe effects and side effects that we come to see only when the person has recovered from that critical illness and now they are in the recovery period, is when we go from rehab services to go to see their patients. So some important effects that concern us, or we typically see when these patients are recovering after the COVID-19 illness, is that patients have no memory of what happened to them, how long they've been in the hospital. They don't know where they are in the first place, what day it is, what time it is, whether it's night or day. So they are very often disoriented and confused. And all they are thinking about, once they hear that, oh, you have recovered from the coronavirus infection, all they are thinking at that time is they want to eat, they want to drink water, they want to get up and go to the bathroom, they want to get up and go home. And so when they do try to get up, they find out that they're not able to sit up, they fall over, they're not able to stand, their knees buckle, they're not able to walk, they don't have proper control over their body movements. So they're not able to, for example, bring a toothbrush to their mouth and brush their teeth, bring a spoon to their mouth to feed themselves, not able to put their socks on. So all this is going on. And even if they're able to do any of this, they find out that they get tired or fatigue very easily. They're huffing and puffing at the end of a simple task like walking a few feet in their room. So they may think they're all better, but they don't realize that their lungs are still healing and their muscles and the rest of their body needs to get stronger before they can actually go home safely. So we need to bridge the gap between ICU survival and going home and help them during this trajectory of the recovery. And that's where we come in, all four services in rehabilitation and nutrition, we come into the picture. I also wanted to mention some specific problems that we see related to COVID-19 infection. There is an increased risk of blood clots. So a patient can develop blood clots in their legs, and often they can break loose and cause blockage in their lungs. So this, on top of everything, affects their breathing. Secondly, clots can develop in the brain, causing strokes. And interestingly, sometimes the first presentation that they have a COVID-19 infection is that they come with a stroke and they get tested and find out they have COVID-19. Then everybody's heard of hydroxychloroquine, which has been used to treat COVID-19. One of the side effects of this medicine is severe neuropathy. So these patients can develop burning pain in their feet and their legs. So they're not able to stand, they're not able to walk, climb stairs because it hurts. Also, when these patients are connected to the ventilators, a lot of times they are placed on their stomach. You may have heard CNN reports of prone positioning and so on. So they're placed on their stomach in order to help their lungs get more oxygen to their body. So when they're placed in this position, they can be in this position for 12 to 16 hours a day. So they're placed kind of with their head and neck turned that way. Their arms and legs are placed in positions where they are not stuck under their body. And because of this, you can get complications later in the recovery period. So there can be pressure on the nerves of the leg, where that can cause weakness in their ankles. We have all heard of foot drop or drop foot, so causes weakness in their ankles, which gets in the way of their walking and their balance. Then the position of their head this way, turned this way, can put pressure on their voice box and their swallowing processes and affect speech and swallowing. So in the recovery period, when they think they're all better, they're hungry, they want to eat, they want to drink water, but it's not exactly a piece of cake. So I'm going to turn it over to Elise to talk about the nutrition part of COVID-19.
All right, thank you for that, Marcia. That was a wonderful explanation. I do want to add a few things. I'll be a bit more brief. Nutrition does come in after people come out of the ICU for sure, but dietitians will also play a role in figuring out the best way to feed you when you can't eat if you were on the ventilator. They'll help you figuring out what is possible as far as can we do tube feeding or is it important to do a version of TPN, parenteral nutrition or nutrition through an IV. So nutrition does come in there as well. Nutrition plays a vital role in the rehab. As Marcia described so well, your body is breaking down muscle tissue because you need protein when you are in an ICU situation, when you have an acute illness, and that will make you weaker, but that will also increase your protein needs. And so dietitians will play a role in helping you get enough protein afterwards. One thing I want to add is the lower access to healthcare, sometimes the lower health literacy, also includes sometimes lower nutrition literacy and lower knowledge of comorbidities. There are very many patients that I've seen that come to the hospital and they didn't know that they had diabetes, or they didn't know that they had hypertension. And they get into the hospital, they go to the ICU, they survive, they fight off the disease, and then afterwards, dietitians will play a large role in helping educate the patient on the role that nutrition plays in managing their chronic illness that they had before, but is newly discovered for the patient.
Yes, I think, Elise, you bring a point that many people don't even consider is critical to know beforehand that you have diabetes or hypertension. And it is very scary when someone shows up and they have those conditions undiagnosed. So I want to bring now Susanna, because I want Susanna to explain to our audience the multidisciplinary approach that Northside brings to someone that is recovering from COVID-19 after spending time in the intensive care unit.
Sure, thank you. So research has shown that patient outcomes are optimized by using a multidisciplinary team approach. This has been particularly critical in the lives of COVID-19 patients, given their degree of deconditioning and just the toll that COVID-19 takes on the body. So some members of the multidisciplinary team in the hospital would include physicians, nurses, advanced practice providers, intensivists, pharmacists, dietitians, respiratory therapists, physical therapists, occupational therapists, speech language pathologists, case managers, and medical interpreters. So as you can see, that's a huge team of people that are managing one specific patient. So Rehab can help play a particularly important role in facilitating communication between the medical team as well as patients and their families. We're involved in patient care throughout the entire admission, and we're always focusing on discharge planning. So our goal is to help patients achieve independence to return to home and to work. Given the fact that Rehab is working with these patients daily, we spend a lot of quality time with these patients one-on-one, and we're often the first to recognize some subtle changes that could be going on with the patient, such as their emotional status, their cognition, their respiratory needs, or even just their endurance. We're always sure to communicate this with nursing, and then we'll also collaborate in regards to how they're meeting their goals, such as walking or talking or whatever it is they might be working on. Collaboration between rehab disciplines is very important as well. So between PT, OT, and speech, we're always communicating between each other to check in and see how our patients are doing across the board. You know, we primarily communicate with other members of the team, either just in one-on-one conversations or in ICU rounding, or really rounding that occurs on any of our medical units. And that is more of an open discussion format that provides an opportunity for everyone just to kind of discuss the patient at one time. So that can be really helpful, even for just bouncing ideas off of each other between team members. We also utilize case managers to facilitate discharge planning, and they work at determining what situation a patient will have the best opportunity for discharge in. For example, some patients may require rehab to continue to work and get stronger when they're released from the hospital after COVID-19, or they might be more appropriate to go home and work with home health therapy or even outpatient therapy if they're a little bit more independent. So those case managers are a great support system to provide counseling, or basically just help find resources for patients or families who may not have access to adequate medical supplies or equipment, or for patients or families who might be uninsured. So they're a great advocate, basically, for our patients. Another key component that we utilize here at Northside is to do a lot of education with patients and families and caregivers. You know, whether that be teaching a family member, okay, when this patient goes home, you're going to have to help them be able to transfer in and out of the bed, or getting up and walking. There also can be specific dietary modifications that a patient might need to follow at home, such as chopping up their food or utilizing thickened liquids. So we work really closely with families and know that families are an integral part of our discharge process to help ensure patients are successful at home. And typically to minimize infection or infection control here in the hospital, we are doing most of that training at this point on FaceTime one-on-one with families. But if that's not successful, we can certainly make accommodations to try to just do one-on-one training with family members while we're here. So, and Elise, I know I kind of touched on nutrition. Did you have anything to add there?
Absolutely, absolutely. If anybody has any swallowing difficulties that the speech language pathologist identify, whether they've had a stroke as a side effect, or whether they have been on ventilation for a very long time and they just have weak swallowing issues, their dietary requirements might be different. Specifically, how thick their food is, and the dietitian will play a role in what foods can we find that you like that fit the textures that you need at this time. The dietitians right now are not going into the rooms in the hospital to help prevent infection, to help minimize the number of people who are going from room to room to room on the COVID floor. We are primarily doing our consultations over the phone or telehealth with interpretation services if there is a language barrier, such as if the patient is Spanish speaking. And so my encouragement, and I just want to point out here, just because you may not speak English does not mean if somebody's calling you on the phone that they can't communicate with you. So if you are in the hospital and you're on the COVID unit, answer the phone, because it might be someone who's really trying to help you and has important information for you.
Very, very important. And I want to remind people who are, enjoying this webinar to ask questions. We are going to have a portion of this event where we're going to answer those questions, and we welcome them as you have them. I also want to ask you ladies, how often do you get to engage with the doctors and the nurses who are on the ER, on the most of the front line per se, in the fight of the COVID-19? Do you get to have consultations with patients that are coming to the ER, or that is, it happen to you?
No, I mean, not really. We don't have any, I guess, ability or communication with the ER docs. I understand they are the front of the front lines, and but we are in regular communication, regular contact with the second front line, which is our ICU doctors, our internal medicine doctors, and then all the ICU nurses and all the nurses on the COVID unit floors.
Good, good, because I wonder if you guys have to be in those situations. Now, any of you, I would like to know if you can provide specific cases, examples where you can share with us how you have worked together in the recuperation of a patient, in one case that has been successful. Can you share that with us?
Yeah,
absolutely.
So we're going to share, we've had actually many success stories in this patient population. And so we're just going to share one of them where we all were able to work together to have a successful outcome on this patient. So we have Miss B. She's a 55-year-old Hispanic female. She's married and she used to work as a cleaner in hotels, schools, and buildings like that. And she did not have insurance, or she does not have insurance. So on March 20th, she experienced fever and chills. She went to the Spanish clinic on that day thinking that she had bronchitis. She thought she had a COVID test done and remembers being told that it was negative, but that's all she remembers. On March 23rd, she was admitted to Northside with COVID-19 pneumonia and respiratory failure, and her symptoms got progressively worse, and she was admitted to the ICU on March 25th, and there was a breathing tube put in her throat, and she was connected to the ventilator. So she was sedated, she was placed prone on her stomach, she was given medications to paralyze her body to allow it to rest and heal, along with the usual medications that are used to treat COVID-19. So she was on the ventilator for 51 days, which is almost 2 months. So during that time, there were discussions with her family about what if she doesn't recover? What do you want to do henceforth? What decision do you want to take? So there were discussions with her family. At one point, her husband had kind of decided to let her be disconnected from the ventilator, kind of terminate life-saving efforts and so on. In the next week, if things don't get any better, they were waiting for a family member to arrive. So we were at that point. Miraculously, she showed signs of recovery. and she was off the ventilator on May 14th. Physical therapy, that is, I started to see her on May 4th, and occupational therapy was started on May 7th while she was still on the ventilator. Initially, she was kind of drowsy, groggy, coming out of those sedative medications and all the effects of those medications, but she was gradually becoming more and more alert and awake and able to participate in therapy. And then speech therapy was started on May 17th after she came off the ventilator, after the breathing tube was out and she was off the ventilator. So we talked about her being on the ventilator for 51 days. Our body, something interesting to know, our body typically loses 18% of our muscle in the first 10 days of being in the ICU. And this process starts as rapidly or as fast as in the first 3 days of being in the hospital. So even though she was able to move her arms and legs, she was still extremely weak. So we started out by working with exercises to strengthen her arms and legs, working on just being able to get up from the bed and sit up at the side of the bed without support, holding herself upright. Then we progressed to standing up in the walker, putting weight on her legs without buckling, then taking baby steps to a chair with help, and then able to sit up in the chair instead of spending all her time in that bed. She needed 2 people to do all these little tasks at the bedside that we take so much for granted. On May 19th, she was able to stand up in the walker. And I like to play games with my patients because they're so isolated in those rooms. So we had 2 of us stood next to a wall and played tic-tac-toe on a whiteboard with our marker pens. So I found out that she could not draw on the board with her arm above the shoulder level. She was only able to bring her arm up to here, up to the shoulder level. And then, well, obviously I won the first few games. She won the last game of tic-tac-toe. And after that, she said she was tired and needed to sit down. So she was standing for 3 minutes and then she needed to sit down and rest. So after that, then she walked for 10 feet in the room with the walker with support because she was still kind of off balance. And then she needed to sit down and rest because she was tired. We were following her with a chair the whole time in case she lost her balance. And then she walked 10 more feet back and sat down. And with all this, she was huffing and puffing at the end of this walk. So I taught her breathing techniques to overcome that breathlessness, slow down her breathing to help her recover from all that much exertion. And I showed her how to pace her breathing with her steps as she walked. So breathe with her steps, take time to breathe while she walked, and then practice slow, deep breathing while she was resting in the chair to help her recover from that feeling. The next day, she was transferred out of the ICU to the floor, but she was still on oxygen. So here I want to stress that all of our patients are warriors, okay, complete warriors. That's the truth. They want to get better, they want to get stronger, they want to go home, go back to work and take care of their families. They have never refused therapy so far. They're always waiting for us to come for their rehab and see them in their isolated little rooms. They are, completely shut off from the world in those small rooms and they're waiting for us to come and do their therapy. Yeah. And
that's incredible to hear.
Yeah, it's very rewarding. It's very rewarding.
And, you say that the patients are warriors. True. I have seen when I used to work as an interpreter, I've seen people recuperate and they are warriors. Takes a lot of strength.
Yeah.
But I also want to commend you because I know the work that you do and I don't believe people understand how important is the work that you do. I know that in order for you to speak, you need to learn how to eat first. And I have great appreciation for speech pathologists because work, it is tedious, it is so important. And in occupational therapy, my goodness, it's incredible. I now play more games with my kids because of what I learned from occupational therapy. And speaking about that, I want to go to Melora because I want to know what recommendations do you have for patients that are experiencing some effects after, you know, they have rehab and nutrition. I want to know what is your advice?
Well, if you can imagine, at the time of discharge from an acute care hospital, COVID patients, first of all, they may still be COVID positive. They could be cured from this illness and they could be testing negative, but it is possible that they are discharging with still testing positive. However, in either instance, whether now COVID negative or COVID positive, they're still experiencing the effects of this infection. They may still have decreased cognition, memory deficits, delayed processing. They may have higher level thinking issues or inability to concentrate for long periods of time. They have fatigue, requiring rest breaks. They need to pace themselves to be able to just get through general activities. They may or may not still require supplemental oxygen. They will have shortness of breath on exertion, possible, like I said, possible needs to take home O2. And then there's also the psychosocial deficits that they have coming out of all of this. They've just been isolated. They may have PTSD from some of the things that they've experienced. They may have anxiety, depression, or also all the increased stress that comes back with, I need to return to my normal routines. I need to care for my family. Some of these patients could have continued fine and gross motor coordination deficits, decreased strength, decreased endurance. They may only be able to tolerate short bursts of activity. They have more fatigue. Some of these patients experience neuropathy in their hands and feet, which is numbness and tingling that's impeding their balance or their ability to complete fine motor tasks. They may have pain. They, some of them may have a decreased appetite, or they're still experiencing speech and swallowing deficits. So given all of that, when a patient is discharging from the hospital, first and foremost, they need to continue with the self-isolation and quarantine practices as recommended by their physician, given if they're COVID positive or negative. And this could include, practicing hand hygiene, social distancing, wearing a mask, all of those things. The other thing is that they need to seek guidance or help from their family and friends to assist them with self-care tasks as they need them. They may need help with bathing and dressing. They may need help with mobility or other higher level tasks that they can't immediately reintegrate to. We're also recommending that these patients, their lung function hasn't entirely recovered. They should be using energy conservation techniques, pacing themselves, practicing pursed lip or diaphragmatic breathing to help them improve their lung function. And also, it's very important that when a patient discharges on home O2, that they continue using their home oxygen as recommended by their physician or their respiratory therapist. It's not just something we're sending home with you to use whenever they think. You have to use it as prescribed because it will help with your recovery. Often these patients are not able to complete their self-care or their mobility per usual, and we may recommend some durable medical equipment like a walker or a rollator, which is kind of like a little Rolls Royce of the walkers with a little seat on it so they can sit down and take rest breaks. Or maybe they need a shower chair or a bedside commode because they're too weak to get to the bathroom several times at night. And all of these things are recommended to improve their safety, to decrease their risk for falls, and to make sure that they're able to complete as much self-care as they can on their own. And then the biggest thing is that we want to utilize home health rehabilitation services and outpatient rehabilitation patient services, which include physical therapy, occupational therapy, and speech therapy as needed. As mentioned earlier by Susanna, some of these patients may be not discharging directly to home, but they could be going to a rehab facility first. But those that are discharging to home, we do want to make sure that they're getting set up with the resources as far as PT, OT, and speech that they need post-discharge. Now, as you know, kind of the common theme or things that others have mentioned is that there are some barriers for the Hispanic population. We've talked about decreased health literacy. Some of these patients may not understand the importance of following through with the medical professional's recommendations at discharge. They may not be aware of the resources that are out there to help them with their recovery or even how to access them. So reaching out within the community to find out how to get those services. And then also we want to talk about the fact that some of these patients may not have insurance to allow them to access these post-discharge resources. One of the great things about Northside is that we do have a financial assistance program where on a case-by-case basis, patients can be looked at and medical necessary services can be provided to those who are uninsured as needed. And then we also need to think about these patients because they truly discharge thinking, I need to get back to work. Many times during our treatment sessions, these patients are talking about their work and their family and the people they need to care for and the stress that they're taking on because they're in the hospital, but they have these things that need to be attended to in the community. So these patients are leaving with an increased pressure to return to their jobs at full capacity so that they can bring in the income to care for their family. But returning to work is a difficult task for these patients. Post-COVID patients will not have the physical, cognitive, or emotional capacity to be able to return to work at the same capacity prior to their COVID diagnosis. The time it takes for these patients to return to full capacity varies based on the severity of their deficits, how long they've been in the hospital, and the recovery for every individual is very different. Some patients may recover more quickly. This could be based on age. This could be based on previous comorbidities, the length of their hospital stay, any complications that occurred while they were in the hospital. So when these individuals are returning to work, they will require work modifications, alternative schedules to accommodate for the residual deficits that they have of strength and endurance, cognition. Employers truly need to keep in mind that these patients' work capacity will be affected. They may require light duties or alternative job duties. Initially, these individuals may only be able to tolerate working 2 to 3 hours a day. They may also take increased time to complete simple tasks that they could maybe complete in 20 minutes previously, but now they need an hour because they need to rest between, especially as a lot of these patients are physical laborers, they're in service industry jobs, and employers truly need to be understanding. They need to be compassionate towards the needs of their post-COVID employees so that they can eventually return to work at the company that they work at.
And it is so, everything that I'm hearing is extremely important. I'm hoping that this conversation really gets to employers who have Latino workers, because what you said, Melora, is so true. The majority of the Latinos who are recovering want to recover because they want to be there for their families. They want to provide. They know the responsibility they have on their shoulders. And we are very family oriented, our community. So one of the things that I think we cannot underscore more is the fact that we don't want to get sick. Listening to you scares me to possibly be exposed to the virus, because a lot of people are, of course, we are all tired of being in confinement. The ones who are blessed enough to work from home and not having to go out and work. And we are tired of Zoom meetings and everything being on the computer. We want to go out and enjoy life as it was before. but this scenario of having this virus and then, you know, spending time in the ICU and then rehabilitation, it is a scary, scary scenario. And I want to thank you for painting a picture of, you know, the gravity that this illness brings to the body. And we are still learning how to fight it. And I'm so happy to learn about the interdisciplinary approach to the recovery. We don't have much time. We have 2 questions so far here. So I want to throw this to any one of you. In the most critical cases you have seen, which are the major post-COVID-19 effects that may lead to rehab?
I think it's this one patient that who came with a stroke. He came in with a COVID-19 infection and experienced a stroke because of that. He had severe deficits where he needed at least somebody's help just to kind of get up and walk, just to kind of get up and climb up the stairs to his apartment. That was the special case that when we had to call the family member for a one-on-one training on how to help this patient physically before they got ready to go home. If we had the opportunity for them to have rehab, we would have loved to have taken it. But you know what? Unfortunately, most of these patients don't have insurance, and we have to do the best under the circumstances that we are given for these guys.
I think to add to that, a lot of these patients are leaving and going home with decreased endurance, decreased strength, and they're not functioning at their full capacity. So even though, you know, they could be independent or what we call standby and just need a little bit of help with things, they really aren't doing a lot. They need a lot of rest breaks, and that really affects their day-to-day functioning.
I have another question. Someone is asking, in thinking about the COVID-19's contagion, most patients will not require hospitalization. What are some of the symptoms we can expect to have? Are there additional tips we can use to mitigate the severity of the impact if we do get it?
I think the symptoms are pretty, typical as they have been explained everywhere: shortness of breath, fever, flu-like symptoms, fever, body aches, fatigue, nausea, vomiting, diarrhea, that kind of stuff. But if they don't have such, severe symptoms which need them to come to the hospital, and if they can be managed at home, then some of the things that they could do is to work on deep breathing exercises, to spend some time on their stomach, because that position seems to help provide more oxygen to the body. Make sure that they are hydrating themselves, just like in flu. When they have the flu, they have to make sure that they are hydrating themselves, getting good nutrition to fight this virus from a home setting, without having the need to come to the hospital. So
there's another question, and this I believe is for Elise. What types of food patients with COVID-19 or post-COVID need to avoid, if there's any?
Yes, so if you are at home, you're not going to need hospitalization, and you require COVID, just like Marsha mentioned, you need to stay hydrated. And it is important to manage any chronic diseases that you have. So if you have diabetes, then you should be making sure that you eat regular meals at regular intervals, which means not going too long between meals, having probably about 3 meals and 1 to 2 snacks a day, and avoiding an erratic meal pattern, meaning that some days you skip multiple meals and some days you graze throughout the day. We want to have a consistent meal pattern. So it's not only what foods, but when are you eating them and how much at one time.
No intermittent fasting.
That's not a good idea for if you have diabetes. Don't play with an erratic eating pattern, if you have diabetes, and even if you're not sure because you haven't been to the doctor in a while, it's not a good idea to be eating an erratic eating pattern. That is bad for your blood sugar, and your blood sugar, if it's poorly controlled, weakens your immune system. So very important for most of us. We want a strong immune system, no erratic.
Absolutely. What are the foods that will boost our immune system?
So that's always an interesting question. There is, if you have vitamin and mineral deficiencies, that weakens your immune system. If you're getting improper nutrition, that weakens your immune system. However, if you do not have deficiencies in vitamins and minerals, excess of them does not make your immune system extra good.
Mm-hmm.
So that's an important reason we don't want to kind of take vitamins and minerals just because we think they'll help. Make sure that you are seeing your doctor and seeing if you have, for example, I saw one came in a vitamin D deficiency.
Mm-hmm.
A lot of people do have a vitamin D deficiency, and that will weaken their immune system. But you should check with your doctor at your annual physical, get your vitamin D checked so that you can determine the right dose to be on.
So we should not start buying stuff just because we think, oh, this, if I have extra vitamin D, is going to be good for me. Is counterproductive.
Go to your doctor and have them check. We'll check for vitamin mineral deficiency like vitamin D. Check for diabetes. Check for hypertension. Definitely go to your doctor. Don't try to dose it just on your own.
Wow, very, very important. I'm one of those people impulsive that would buy over-the-counter supplements. Susanna, is there anything that you would like to add that we haven't discussed and you think is important to bring to this conversation as we are about to close the webinar?
Sure, absolutely. So yeah, within the realm of speech language pathology, we're working on a lot of different things in the setting of COVID-19. Really, while patients are here, we're trying to optimize, like Elise mentioned, nutrition and keeping you safe with swallowing. One of the biggest issues that we're seeing is that since patients aren't able to adequately support their respiratory system or breathe comfortably on their own, they're at much higher risk for choking while they're eating and drinking. So that's something for the general population to be aware of is, if you ever are getting to a point that you are so short of breath that you are not able to maintain nutrition and hydration, that absolutely warrants a call to your doctor. So yeah, I think it's something that, of course, we never want people to get to that point where they're needing our help, but it's important to recognize those signs as early as possible and discuss that with your physician.
Absolutely. Thank you, ladies, again. And I really want to say to the public that has never done rehab, thank goodness, that if they ever need, I believe the people who work in rehabs at the hospitals are the most compassionate individuals that I have met. You guys are inspiring the patients that you have. Towards the recovery of patients, and also being firm by not doing things for them and allowing them to learn. That I learned from occupational therapists because I wanted to help, and I was not of help. I do the job for them. So you guys, they are the warriors, but you guys are the commanders and the generals. So thank you for your time. Thank you for providing this incredible information. I want to thank Northside Hospital again. You can see that phone number is where you can have schedule your centralized scheduling for rehab, and you can call that number to obtain more information. I want to thank the Georgia Hispanic Chamber of Commerce for providing the space to have this discussion and for being of service to our community. And I hope that we can talk more with you guys in a couple of months and say it's over. We don't have any more COVID-19. That is my wishful thinking. That I will close this webinar. Thank you again for your time and for your expertise.
Thank you for having us.
Thank you.
It's been an honor. Thank you.
Thank you. With that, we're closed. Thank you.